Hello, and welcome to Conversations with Cheryl Weston. We've got a very interesting and a different approach to our show tonight. Hope that you will enjoy it and be sure to click that button of like and also um, to make sure you subscribe. So, we have a special guest. We're going to be talking about doulas. And it looks like our special guest is on board with us. And we want to talk about this because it's something particularly in, I would say, in black and brown, non-white birth rates are very high for mortality. There are also things that are being done now that they can participate in that maybe a lot of them haven't participated in the past. And that's the reason why I wanted to bring this up because it is very important with all the legislative changes that have been made regarding pregnancies, women's health. And so I wanted to talk about doulas. So I found someone who I know that is involved, very in much involved in it. And also, I have to make this disclosure because you know we like to make disclosures and be truthful, honesty, and about our programs here at Conversations with Cheryl Weston. My special guest tonight is my granddaughter. In- so um, we have Marcia Anderson, who is a certified doula. And so at this time, I'd like to give her a few minutes to introduce herself to our audience as to your involvement in this type of program.
Okay, thank you for having me. I really appreciate it and appreciate you bringing light to the doulas because it's something that needs to really get out, especially for the Black and Brown community. But my name is Marcia Anderson. I became a doula in October 2021, so almost 4 years. I originally did my training with the National Black Doula Association. There's several different organizations where you can become certified, but I chose to do it with the National Black Doula Association because my people, I wanted to learn more than just how to help people. I wanted to learn about how it started,
Mhm.
when we were wet nurses and how really we were midwives during slave time. So that was really important to me. And then upon that, I was a doula for a couple of years. And then IB Black Girl presented the opportunity to do doula certifications. And some of us who were already doulas got to take that training. And so I did that as well. So I have a dual certification with both of them. So yeah, in October, it will be 4 years. What made me become a doula are a couple different reasons. For one, I grew up in Omaha, Nebraska on 26 in Decatur. Right down the street from me, I saw drug dealers, I saw prostitution,
Mhm.
really just bad area. And I did not see a lot of Black successful people. And so I've always known from like the age of 3 or 4 that I wanted to be in birth work. It was just something that was always important to me. But also, my mom had a baby, my sister, and at 9 months of pregnancy, my mom delivered a stillborn.
Oh
My
my
sister
goodness.
would have been older than me, but to this day, we never know. I've never found out what happened. And so
Mhm.
that was always important to me to never let anything like that happen again. And
I think you froze. Let's give her a chance, a moment here to, yeah,
is it better now?
yeah, you froze for a
Okay.
minute.
Sorry. So did you get everything? Were you able to hear that?
Yes, we got
Okay.
that. I'm gonna have to have a break for just 1 minute or maybe two. I'll be right back and then we'll continue. Just a second.
Okay. Mm.
Okay, so we're back to recording. When you one thing I'd like to kind of find out now when you say that there are several organizations, are that you're certified with. So do you have to be certified with each to be a doula?
No, you don't. I just chose to go ahead and do the other one with IB Black Girl too, just because
Hmm.
it was a nice opportunity. But you don't. I just like to also do continued education, so I
Okay.
won't get stagnant.
Yeah. Well, let's get into now we know kind of why you got involved. Um, what would be your definition of a doula?
Mhm. So, a doula is a trained professional. I always make it clear we are not medical
Hmm.
professionals. We are a trained professional who administer emotional, physical, mental, and informational support to birthing people while they're pregnant, during their labor and delivery, and during their postpartum. So, like during your pregnancy, I am going to doctor's appointments with you if you want, just so you can have an extra ear. Sometimes I may notice something like, hey, that's not good. You're showing signs of preeclampsia or showing
Hmm.
signs of gestational diabetes. You may want to get that checked. And a lot of times, it's spot on. So that's very good. And then during that labor and delivery, the doctors aren't in there until it's time to have the baby. The
Hmm.
nurses are in and out because they have a lot of other patients to care for. So I'm by your side the whole time. I'm doing different comfort.
I was gonna just say you when you said you're by your side because are you allowed to go to the hospital and be in the
Yeah.
delivery room? And the reason why I bring that up in a conversation with a nurse at the med center said that more and more strides are being made to allow the doulas to be into the whole process, coming to the
Mhm.
hospital, being involved in the whole thing. But that's not necessarily true at other states or other
Mhm.
in locations. So it is important that that does occur. Is that in all the hospitals here in Omaha,
Mhm.
or is it okay? So you
So
could have
we're
this
working with the hospitals.
in the
We
hospital.
There's a whole program going on right now to allow the doulas in there.
Okay.
This has been going on for about a year and a half now. So the
Okay.
hospitals are getting better at allowing us in there. And UNMC even have badges for us now.
Yeah, that's according to her. That's the reason why I'm saying. So there's some hospitals that are a little better at it than others, but as far as you know, they will usually work with the mother in order because isn't that something that would probably be set up before you come in anyway?
Hmm.
Is try to have that because that's less stressful, especially if you've
Yeah.
had somebody from the beginning all the way and now we get down to this and you don't, that takes away. Let me when you say that, and I want to make it very clear to people, and then you can confirm it. You are not the same as a midwife, or because you are
Correct.
not medically, professionally licensed to do that.
Correct.
But you are, do you have to have those licenses underneath the state of Nebraska to be a doula? Do you have to have that?
Yeah, so you have to be a certified. You could be a trained doula, but you have to be a certified doula. So I do have a
Mhm.
certificate. I am a certified doula. But you are correct. I am not a midwife. I am not
Mhm.
delivering any babies or doing any kind of like exams to check for
Mhm.
anything for mom or baby.
So really, the one good thing about being or having one
Mhm.
is your focus is the mother.
Correct.
The
Absolutely.
woman who's going through you're not focused on all the outsides or the medical, and that makes at this time in your life, thank God that I
Mhm.
don't have to worry about that anymore. But when
Me
you're
neither.
pregnant, if you can have somebody that you feel like
Mhm.
is, oh, they're all for me 100%. I am the
Mhm.
focus of this. So,
Mhm.
I think that's great. And that's something that should be pointed out to women that how much this would mean to you during this time because you
Mhm.
got 10,000 other things and the stress. So let me
Yeah.
ask you, in Nebraska and in particularly say in Omaha, does Nebraska Medicaid cover this or does it have to be private pay? How does it work?
Yeah. So right now, Nebraska Medicaid does not pay for it.
Hmm.
They are legislation is working on that. Molina Healthcare, who took over Healthy Blue, in their explanation of benefits. They say they pay for doula services, but it's
Mm-hmm.
really black and white. They really don't.
Mm-hmm.
But I Be Black Girl have a couple of pilots going on to where Medicaid have covered it. So they've had one with Nebraska Total Care and United Healthcare. They have another one going on with Nebraska Total Care right
Mm-hmm.
now, and that's not in all states. It's just here in Nebraska. Um, there's a lot of different pilots that we've had here in Nebraska that will pay for services. Some of them have been just for minorities because, as we know, we're treated a lot less fairly. And then
Mm-hmm.
some people will seek out a doula themselves and self pay. So I've gone through both the pilots and I've had self pay clients.
So otherwise, if does insurance companies, other than, like if you have insurance, maybe where you're employed, you're not, and you don't even have Medicaid, do those insurance companies pay?
There are some insurance companies who do pay. It's very rare that insurance would pay for a doula, but there are some. And I do believe like you have to be certified.
Mm-hmm.
There's a lot of stipulations. I think I've only had one person who insurance was going to pay for it, and I can't remember why we didn't bill her insurance, but it's very rare that insurance would pay for a doula.
So you work with like, does Charles Drew or One World, do they provide doulas? Is that something that they work a lot
Yes.
with?
Mhm. So I can't speak on One World because I don't work for them, but I work for Charles Drew in our
Okay,
Omaha Healthy Start department. And so some the doulas here in Omaha who are certified, they are contracted with Charles Drew.
wonderful.
Before I started working for Charles Drew, I would send my clients through there and get paid through them.
Mm-hmm.
So now they have kind of changed their stipulations. Like you have to have a high need. Like let's say you're currently having complications,
Mm-hmm.
or if you've had a negative birth outcome before, like let's say you're really young or older parent, or you don't have support, then they will pay for your doula services, full doula services. So what that means is they'll pay for your services you get before, they'll pay for your services during your labor, and
Mm-hmm.
then they'll also pay for your postpartum services.
Okay. So that's through. Now, is that Charles Drew throughout Omaha, just the Charles Drew Health System, or just certain location? Okay. So,
Just Maha Healthy Start.
okay. Omaha Healthy Starts program.
Yeah.
And so, um, is there anything being done? I guess, how do you get the word out? How do you let people know, women know about that?
It's just a lot of word of mouth, and a
Uh-huh.
lot of women didn't know about it. I would be honest, I didn't know about it before I became a doula. I think I was just searching birth work, and I
Mm-hmm.
saw that I'm like, oh, wait a minute, what is this? And I just started doing my research.
Okay.
With me working for Omaha Healthy Star, when I enroll a pregnant mom, I usually tell them about a doula.
Mm-hmm.
But it's mostly word of mouth, and I do feel like it's kind of um, being advertised a little more because it's something that just was not advertised enough.
Mm-hmm. Well, then maybe someone needs to do a pilot program is getting the information out to the doctors, the physicians' offices. That's how things get started. Somebody
We
has to
do
get it started.
actually. We have that at UNMC. So they
Hmm.
have a pamphlet with all the doulas who's registered with them, and then they'll let the moms know. With this program, though, you have to have Nebraska Total Care.
Hmm.
And actually, this one right now, I made that up. It's not with UNMC any longer. It's with CHI. So
Okay.
they'll usually let them know, and then they'll look through a pamphlet, and then they'll kind of like see some doulas, and they'll interview them. So yeah, we've been working really big with the hospitals, and they've gotten better. We haven't had any kickbacks about being there during the labor and delivery, like getting in. We've had more kickbacks, like let's say the mom is having a C-section. That's where they have tried to fight us and not let us in the operating room. But yeah, the hospitals are, they know they have to, we're considered a staff. So usually you may only get like 2 or 3 visitors. We're not considered a visitor.
Hmm.
So
Well, yeah, and I could understand maybe in a C-section because that's mainly like almost a surgery is anything could go wrong or something and you have to be out of the way really quick, quick, quick. And a C-section is a lot different than having it you know, uh uh through the vagina is to have that. I could understand that. I mean, I can have some understanding on why they
We've
may
actually
not.
been doing better though, letting us
Hmm.
in during the C-sections, just because again we're there to support the moms,
Hmm.
and usually, and I give whenever I'm doing a birth plan, I give the mom an option. I always say, if for some reason you were to have a C-section, would you want just your partner back there or your doula? And the reason why I kind of advocate for a doula being back there is because once that baby is out, that's where all the focus is. But like you said, the doula, I'm there. I'm making sure mom is good. I'm making
Hmm.
sure her blood pressures are good. She's not bleeding out. And then, getting cut open 7 layers of skin, all that anxiety. So I'm there making sure
Hmm.
that they're still good. So of them are getting better at letting us in the operating room.
And C-sections are different. Some are
Mhm.
wide awake and everything. Some they have to be under sedated or so it's different, but it's good that they're allowing you to be in there because as you said, the focus is the mom. It's the one
Yeah.
time that probably she'll ever get that's always focused on her and totally. So what have you found I should say I don't know if most rewarding is the right word, but what have you
Mhm.
found that really you find that, oh man, this is just what I need. This is what I enjoy. What do you
Um, so I had a mom in particular.
uh-huh.
And unfortunately, her baby passed away 2 weeks after having the baby.
Oh.
But I was able to help her so much. And she just appreciated my service that
Mm-hmm.
she now just became a doula. And I am so proud of her to see, what
Yeah.
she's doing. And there are a couple of people who've taken the course through IB Black Girl. And,
Uh-huh.
it was a couple of them say that inspired them, and they're the reason why they wanted to help other moms. So I do feel like that has been very rewarding, knowing that I can inspire somebody else to help. So,
That would be very. What
mm.
has been your worst experience?
Whew. I will not say the provider's name or what hospital unless you want me to.
No, no, no. You
Um,
ain't.
but there's a certain provider who's not very nice,
Uh-huh.
not only to doulas, but she's not nice to her patients
Uh-huh.
either. And just to actually experience her, but I did have to remain professional and
Uh-huh.
just kind of remind her that, hey, I'm here to back you up. We both want to make sure
Uh-huh.
it's a healthy baby and healthy mom. But I would definitely say
That
that
was
was
your.
my worst. Yeah.
Well, we always have, there's always, well, in my lifetime, I haven't found one it didn't. There's always a good and there's a bad to everything
Yeah.
because there's two sides to everything. So, you know, I would say though, if I only can get that one or very, minimal, very, very small amount, I can hang with it. And
Right.
again, when I think about what I would be doing to help that individual overweighs what my personal feelings would probably be. So that's good.
Exactly.
Um, when you go into this, like you say, you do have more opportunity. So how do you, when you're working for Charles Drew and you put him in the Healthy Start, how are you able to break away to be the doula for him? Or can you be the doula and still for them?
So I'm no longer a contracted doula with Charles Drew because obviously conflict of
Right, I
interest,
would
and
think.
we don't want the other doulas to think that I'm getting, all of
Clients,
the
right.
moms who come
Hmm.
through. So I don't do that. I'll refer another doula. However, with the Omaha Healthy Start program, we're all things mom, all things baby. We're, advocate for positive maternal outcomes.
Okay.
So before I started, that was something That was very important to me. And I spoke to them about that. And they said that I could still be a doula, just obviously couldn't send them through them. So, like, if I have a mom in labor or something, they do allow me to still go attend births.
Oh,
So,
that's good.
it's pretty rewarding that I still get to do both.
Well,
Yes.
that have you ever thought about and don't say, well, it's a little late in life or not because we're
I
never
know
too
what you're about to
old.
ask.
Have you, you thought about, wow, why don't I go and do that extra step and become the midwife or a practitioner?
Have you been talking to my husband, your
Nope.
grandson? So it's so funny. Absolutely, I have. And my biggest argument is that, oh, I'm a little older in age. And
Uh-huh.
that has been what's stopping me. Actually, though, I toured Methodist nursing
Uh-huh.
school. So I have been, thinking about enrolling in nursing school to become a midwife. There's one midwife at Nebraska Medicine. She gave me her personal number and she told me do it. Like she told
Uh-huh.
me she'll teach me personally how to do sutures if I
Hmm.
go to nursing school. So I am actually thinking about
Well,
that.
I am a firm believer in you're never too old unless you
Mhm.
let yourself become too old
Yes.
and you can't learn. But I have been seeing more and more on the internet how uh, one was 80, one was 67. They had to come out of college in order to take care of their family and everything. And then this last one I just saw a couple weeks ago, he was, well, there was two I saw a couple weeks ago. One, she was, what was she, 57, and she got her college degree, her
Awesome.
undergraduate, and she was signing up to take her master's. But the
Mhm.
other gentleman was 80, in his 80s, and he said he stopped when he was what was it, 18, 19, something like that, and he promised himself that he was going to get that degree. And I
Mhm.
think he was like freshman or something, whatever, but he did it. So, and I was like, oh, and his whole
Yeah.
family, and they had a big thing, and they even had it in this town's paper. So you never get too old unless you're allowed. It's just what you get up here. And
Yeah.
so,
Yeah.
I think being involved with bringing life into the world
Mhm.
is, and I would say it for physicians too, is that has to be one of the most rewarding, and
It
probably
is.
losing a life is, you know, just the
Mhm.
opposite. But it's a thing to think
Mhm.
out. That decision
It's
has to
hard
be
to have a
made by
bad
you.
day. It's hard if you're going to a delivery, you think, how could I have a bad day? I'm literally about to see life come into this
Hmm.
world. I love it.
Yeah.
I love it.
Well, it sounds kind of like more you kind of leaning towards that way, and it would be
I
hard
am.
to. Um, One of the other things that when I did some research on this, um, and I don't know, the report that I looked at was Washington State, and they sh were showing the demographics of
Mhm.
who uses a doula.
Mhm.
And it was surprising, and it was Washington State. It was uh, close to 70% is white
Oh,
women
wow.
who use doula. Um,
Mhm.
and so it's very small. What would you say are the demographics for doulas here in
Mhm.
Omaha?
Um, well, I feel like Black and brown women are starting to use doulas more,
Hmm.
but because they're able to get the service paid for. A doula can be kind of pricey, and
Hmm.
like we discussed, insurance don't really pay
Hmm.
for it. So I think that is the reason why a lot of Black women weren't using doulas.
Hmm.
And that's why I'm so appreciative of these pilots that's going on because it's specifically for us. Just like some of the stats in the US, period, Black and brown women are 3 to 4 times more likely to die because of
Yes.
childbirth
Hmm.
complications.
Hmm.
So I think now that the word is getting out more, we're getting those programs to that pays for it. I think they are starting to use them more. I'm not quite sure on the statistics of how many Black women here in Nebraska are using them, but I do feel like the rate is going
Mhm.
up.
When you have, and I would say assume because of the channels that you have received your clients, those have been largely or all Black and brown women.
I've had, I think maybe two Caucasian,
Okay.
two or three, but all the rest, yep, Black and
Hmm.
brown. I currently have one who's Hispanic,
Uh-huh.
but yeah, all the rest have been.
So while you're going to become the midwife or the practitioner, you will be learning Spanish too, huh?
Okay, well, let me put that on my to-do list.
Okay. Another question that in during the research is that, well, let me get back to one other thing because you did mention it and I did want to follow up. What has been the outcome of the legislation that was being worked on in Nebraska legislature? Did that come out of committee or get passed this year, or they're looking for it to go through in 2026?
So I believe it's going through in 2026. I can't say, but I know nothing has been passed yet.
As yeah. Okay.
Um, I'm trying to think. I know the bill is LB. I can try and look up the bill. I can't remember the name of the bill, but I
Okay.
can get that over to you.
Okay. Um, would you think that if we as women and would get medical supporters too, is to push that, support that when it comes up again next year? Does your sources say that it appears to be, is the mid center thinking that, I think we could get this through next year? It just didn't make it
I think so. Most of the hospitals are, they've come, like I said,
supported.
they've come a long way and they're so supportive, but especially the Med Center.
Uh-huh.
Actually, so the training that IB Black Girl provide, they actually do a lot of it at the Med Center. And the
Mm-hmm.
midwives and the nurses have helped train with the doula certification as
Okay.
well. So yeah, there's a lot of push for it. And it's so needed. It's so needed.
Mm-hmm. Well, my other question would be, when you look at this, with all of the things that are going on as far in underneath the government cuts and things, um, do you see that it's going to take, how should I say, longer? Is there ways, is there any lobbying done, I guess would be from medical lobbyists done to push this through? Are you
Well,
aware of that? I know Ivy Black Girl does have lobbyists at work. Is that something that they might be pushing?
I'm not too sure. I can't say, of course, with
Mhm.
the climate right now that they have with being in females' reproductive business, it
Oh,
is
yes.
scary.
Everything's going to stop. That's the reason why I'm getting
Mhm.
is it's, everything right now is like through this legislature, not just Nebraska, but many of the states, they're doing everything to oppose anything that could be, I say, beneficial to women, in the
Mhm.
reproductive line is that, I'm wondering, will it try to get through in 2026 or is it going to have to be put off
I,
again? But
yeah, I don't know. I would hope that it does. I know we were hoping that it would in
hmm
2025. And even, I don't want to say too much about Charles Drew, but I will say even that for a moment there was scary just
hmm
with how everything is changing with the laws,
Oh
with
yeah.
reproductive rights.
hmm
So just fingers crossed that it will be pushed through because
Okay. Um, I was trying to think, seemed like there was something else, one other thing, but I don't remember. What would you like to say as closing for our segment? What would be your thoughts or something you would like to encourage women? I, you know, either to become doulas, to have a doula. What would you like to
yeah.
say and leave our audience with?
Well, The reason I think a doula is so important, and let me make this clear also, because I know a lot of times the fathers, sometimes they're
Hmm.
against it because they think that we're going to come in and take their place.
Hmm.
And absolutely not. If there's a father involved, I love to involve him in a lot of our care.
Hmm.
But it's important. We are not treated right. If you feel like, oh, I have a headache, sometimes it could be a little more than a headache,
Hmm.
or my vision is blurry. You're showing signs of preeclampsia, and sometimes you just need that extra person there to advocate for you.
Hmm.
It's too many times I've seen women dismiss, and I'm like, no, you need to go back. And thank God they did. So it's very important. A doula, postpartum depression, I feel like that is something that's not talked about a lot. A lot of times a woman may be ashamed if she have postpartum depression because you may not bond with your child, and they're like, oh, I just had this baby, I should love them. You're not always happy. It doesn't
Hmm.
mean that you don't love your baby. So and doula is also there to help you during that postpartum depression, or try to combat postpartum
Hmm.
depression. Or a lot of times, if they're trying to breastfeed and they think, oh, my supply is low, and we're helping through that. A lot of times, your supply isn't really low, you're producing enough. And you're just
Hmm.
afraid that your supply is low. So we help through a lot of different situations that's just not known. So I think it's important for any culture, but again, especially our cultures, because we're just not treated right. And let's keep it real. We're in Omaha, Nebraska.
Right.
We're in Omaha, Nebraska. We're in a
Right.
red state, so
And
it's
you
important.
did, you jarred my memory there was uh your services, and I guess it would be based upon your client, you would carry these services over after birth. Is there a
Mhm.
certain time period? How long do you continue the services? Um,
So it just depends on how my mom is doing.
mhm.
Usually, I try to do 4 postpartum visits,
Okay.
but a lot of times I've done them longer. I had a mom, and she had some pretty serious issues,
Hmm.
so bad that we actually had to file a grievance against the hospital. But I had to work with her a long time and figure out, okay, this isn't right. So it depends on how you're
Hmm.
doing in your postpartum journey. I've worked with a mom a month after having her baby, and I've worked with some moms for a couple of months after
Hmm.
having their baby. But I make it clear, once you have that baby, I don't just cut you off and say, "Oh, your baby is here." No, I'm making sure you're doing good.
Okay. That sounds good. Take it as a personal. Well, I want to thank you very much for the time. This is something I want to do more of my shows on is to health, and this is actually mental health or health month. And
Mhm.
I want to do more to inspire people that health is one of your most important things. And,
Absolutely.
everybody kind of has, not everybody, people sometimes tend to have a misconception that having that baby is also easy and everything,
Mhm.
but it's not. And mom, and especially, there's a lot that's going on when there's more than this isn't the first baby, and
Mhm.
there's multiple siblings at home. And so to be able to have someone that is there for them,
Mhm.
I'm sure would be of a tremendous help. And a lot of, I would say, probably your moms that you've been involved with are working moms. So
Mhm.
they've got
I've had a
triple duty.
doctor. I've had a lawyer
Uh-huh.
who I've serviced. So I've had both moms in high paced fields, and I've
Uh-huh.
had some in food service.
Uh-huh.
So yeah,
Yeah.
all walks of life who I've
And that's
serviced.
because we do have babies in all walks of life.
Absolutely.
you know, as hard as we would like to think that, it's all easy pie and all that. Well,
Mm.
again, I'm not saying to encourage or discourage, but we'll be checking back with you to see, do we have someone here who is starting medical, nursing or midwife school and see how it goes. My philosophy, as I always lecture to you guys, are children is that um, nothing beats a failure but a try. And you never know what can happen until you try. And so it's not a
Absolutely.
failure. It's just that it's one thing that you need to either work on or don't do. And it kind of comes to
Yes,
that. So whatever you, I'm sure that the family will be behind you and supportive. So, and
absolutely.
again, thank you so much for your time. We know that
Thank you for
as a working
having
mom
me.
of two very active
I've locked them in the
children,
room.
you told
Yeah.
me that you were gonna. I said, "Well, do you really want to do it?" When everybody's at home, and she says, "I have already given instructions, and I am locking the door,
Yeah.
and
You know,
no
I,
one
I
is."
do want to say though, if you come across anyone or if anyone sees this and they're interested in doula services,
Okay.
please don't hesitate to reach out to you or my email is Mrs. MRS
Uh-huh.
Marcia Marcia
Okay.
Anderson at gmail.com. And it doesn't have to be me. I always say that because I'm such an advocate. Even if you want me to refer another doula to
Okay.
you, or if you want to interview me and others, just as long as you get a doula and have somebody there, your life matters and your baby's life matters. So please reach out if you're interested in services.
Okay, we'll put that at the end of the clip.
Mhm.
At numbers that can reach to you as well as any other. Maybe you can send it over to us and let us know of other services that you would recommend, and we'll put that on that clip, and so they can
Mhm.
be able to contact you. Well, you have a
Okay.
great evening, and again, thank you
You
so
as
very much.
well. Okay.
All
See
right,
you.
bye.
Bye.